Well, I know how long the line was last year, and I didn't want to be stuck. I said best to be first than to be last, so.
I just don't have enough money to get the medical treatment that I needed at home. So they offer this once a year, so I take advantage of it.
Since I can't walk very much anymore, and I can't stand very long, I haven't been able to really get out the house that much. But since I've come in contact with this neighbor and friend of the family, she has, taken the time to take me different places to try to get help for myself. And this is one of the days that she bought me because she knew I needed it.
People are desperate, in desperate need to get health care, whether that's vision, dental, or medical. They're desperate, and somebody's got to respond. If you follow your heart and you find your passion, then you move to action and you respond to it. And so that's what this whole effort is about, is responding.
Is anybody in need of a pen or you need some help?
Here is the list of all the medications that we can fill free for the next year.
Full time I was I hang clothes at the Salvation Army. I'm not working at all now. Can't find a job. I had a heart attack and then got sugar and diabetes and high blood pressure.
I'm a diabetic. I take 5 shots a day. If I didn't have my insulin, then my sugar levels would go to the level that it would put me into a diabetic coma and I would die.
We're seeing very nice, appreciative patients that need blood pressure medications, that have chronic problems that they just haven't been able to afford to get to a primary care doctor to get resolved.
I had insurance, and as a matter of fact, I was hurt on that job. And they covered everything. I had no problems about nothing. And when that job downsized and we lost that job, seemed like I couldn't come by insurance on none of the new jobs that I got, not like that.
I used to work for a company that installed science lab cabinets, and we installed science labs. And we had insurance, and I made fairly good money. And in 2010, I got disabled. Heart disease and lung disease, and messed up my back. And we have no insurance. We had no insurance, and so that cut my wife off. And she don't have any insurance at all. I have Medicaid and Medicare myself on the disability.
But somebody's got to take action and actually get the care out there to the poor and the underserved. And that's what this whole effort is about. It's a collaborative effort between all the hospitals and all the care providers. There's so much collaboration in this.
What is really neat about our community is that we have folks that I feel genuinely care about the community. These are people who work every day, but yet they find time to volunteer and give back. And here we are today because of that effort, because of that commitment, we're able to provide these services to our community.
08 to 33, look at your band. 08 to 33.
This year has been, as medical director, I've had the opportunity to see the collaborative efforts that go into a process of this type. We have advanced practice nurses who are here doing primary care screening. We have physicians assistants who are assisting us. We have medical students who are shadowing the doctors, and fourth-year medical students who are participating in actual patient care. To see all of the healthcare providers, just to see everybody come together in one area, working together for the benefit of the community. To me, it's impressive.
And our group here today, Richland County EMS, we're here for medical emergencies. If someone goes down, if they get sick, if they need to be transported to the emergency room, that's what we're here for, on site, so we don't need to call anybody else from off the street that's running day-to-day calls.
We felt it was important for nurse practitioners to be involved because A, they're healthcare providers, and B, they care for a lot of medically underserved populations across the state and in the Midlands area.
Since this is our third year doing this, I look back and think back to the first year that I did this. You know, as a pharmacist, there are many opportunities where you can volunteer here in the pharmacy, clinical services, whatever. But my first year, I was outside the entire time with an igloo cooler on my shoulder, passing out water to people. Because it was outside, it was really hot. So it doesn't matter what type of medical service or any type of service that you provide. It's about being here and giving back.
When I applied to medical school, my statement was that I wanted to be able to provide care for patients that didn't have access. It's a pretty cool thing to be able to just be there, and I mean, you really do get so much out of it.
Every year at Mission, we have had the mammography vans come to do mobile mammography, and this year's no exception. We're just happy that we're able to be a part of providing that, because obviously it's a service that needs to be provided.
Most people are here because they need some sort of vision correction, and it can be from a mild to a severe vision correction. Most of the time it is interfering with what they do on a daily basis, and so they need these glasses.
It's just wonderful to see how all the people, the volunteers, and all the planning that have come together.
I appreciate it because some things people need, and I tell them, like last year I missed it, and I was like, this year I'm not gonna miss it because I needed last year, and so since I was able to do it this year, I'm over here to take it up and get it done, because I appreciate what they're helping me do, because some things right now is not able to afford right now.
With the help that I get through this program, I can actually afford to pay the bills that I need to pay and get my medication as well.
It is every entity in the community that has come together to try to meet the healthcare needs of our community.
Because it's one thing to talk to people about the services they need, but it's another thing to be able to be here and see firsthand the way a person feels after they have had, you know, teeth pulled or have received glasses or have gone to see a physician. It's a phenomenal feeling that you can't compare.